Hey beauty babes, my name is Steven Mango and you are watching Beauty Fruit. Here on Beauty Fruit we are going to be discussing all things beauty, whether that's at home hair and skincare treatments, facials that you can do yourself, or showcasing all the latest in aesthetic medicine, whether that's Botox, fillers, other injectable medical treatments to enhance your beauty. I'm gonna be showcasing to you guys all of the best that is currently happening right now in the beauty industry, and also interviewing other specialists in all different fields of beauty and aesthetic medicine. And today I am very honored and excited to bring on Dr. K, who is based in Pasadena, California. Dr. K has over 200,000 followers on her Instagram page. She is a facial plastic surgeon and head and neck surgeon, and she is the absolute best if you have the ability to come to Pasadena, California, and you have been wanting to get injectables or any sort of treatments. The number one person I would send you to is Dr. K. She has injected me for my nose, for my chin, for my jawline. We've done Botox lip flips, so many different treatments, and I wanted to bring her here on my channel as an expert guest to be able to share with you all of her different secrets and to talk to you guys more about different Botox filler treatments. We're going to be talking about beauty influencers and getting Dr. K maybe to spill a little bit of tea for us. It is a really great interview and I'm so excited to have her as my very first guest here on Beauty Fruit. If you guys are new to finding me or want to keep up to date with more of my videos, please make sure to go down below, hit that red subscribe button and turn on your bell notifications so you don't miss any of my uploads. So without further ado, this is my interview with Dr. K and I hope you guys enjoy. Today I am joined by the amazing Dr. K. You guys probably follow her at Beauty by Dr. K over on Instagram. Hey. She is the absolute best, and Dr. K actually has done my nose, chin, jawline. We did a little bit of a Botox lip flip. I'm exposing all of the work that I got done because I'm not shy about any of the cosmetic procedures or anything. And today we are going to be talking about everything beauty. We're going to be spilling the tea on beauty procedures, influencers. We have a lot of different fun stuff coming up your way, so if you guys are interested, then keep on watching. So Dr. K, tell us a little bit more about what you do and your practice and everything, Dr. K.
All about Dr. K. Well, so I am a facial plastic surgeon. I'm a board certified head and neck surgeon, so this is my area from here to here. I do faces, and I think that's the best anatomy of the body. I'm here in Los Angeles in beautiful Pasadena, and I run a really awesome Instagram. It's Beauty by Dr. K, D-R-K-A-Y, and you guys can follow me to learn all about the most cutting edge things you can do, non-invasive and invasive. So I do surgeries, I do Botox and fillers, I do very cutting edge facial contouring with fillers. Injection rhino is one of my specialties that Steve has tried. And I'm all about beauty. I'm very open and transparent with what I do with my face, and I want women and men out there to just really seize the opportunity to use the technology of this decade to look and feel your best, because why not? Yeah.
And you have how many followers on Instagram now? 200?
It's like 205,000. It's slowly growing.
And when did you first start on Instagram? Because if you guys don't know Dr. K, if you don't follow her page, she posts the most amazing work of her fillers and Botox and different beauty treatments, and basically became almost like a beauty influencer in a way for a medical professional, which is really cool. So how did you initially get your start on Instagram?
Well, funnily enough, I have 4 kids, and I decided if they were going to have Instagram accounts, I was going to need one too to follow and spy on them. So yeah. As any good mom would do.
That's any mom would do, right?
Yes. So anyway, I started like maybe 2.5 years ago, and it just was me showing glimpses into my work, and those videos got so many views, and then I realized that I have a voice and a vehicle to teach. And my videos have really gone viral, and I have followers all across the world. The interesting thing is I'm followed by quite a lot of injectors and doctors out there. So it's really fun to be able to teach, and I teach other doctors and injectors, nurses and PAs how to do injectables as well. I have a course online, Mastery of Aesthetics. So I really love the idea of using my digital voice to be someone who changes this industry for the better for patients. So I educate patients, but I also want to educate people who are doing the treatments and just make it safer and more fun and better.
And do you think that you're almost able to kind of shift almost like the idea of beauty in a way through your work and through your posts, and kind of showing injectors and other people what beauty should be, or maybe how you can change. Because like me, I was a hairdresser for a long time, and if I worked on a specific celebrity and all of a sudden I chopped their hair off into a bob and put a pink stripe, people are going to request that, then all of a sudden that can become a beauty trend. Do you think you've started any specific beauty trends through filler?
I definitely think that. And when I first started Instagram, it was not a very popular thing to have people getting injections done. Nobody really wanted to be in videos, and so I think I really pioneered this ability for patients to feel like patients want to be in my videos. I don't pay them, I don't do anything extra, but like I educate, and people follow me for a year or more watching all the things I do and learning who I am and how I do it. And so I think the videos that have gone like really trendy are jawline videos. So kind of really amazing jawline contouring was not a thing till, you know, it started to be a thing. And I think some of my videos are responsible for that, as well as like Sculptra for butt injections. So butt augmentation without surgery is so popular that there's a worldwide shortage of Sculptra this very week, which is, I think, halfway due to our videos. And injection rhino. My Tinkerbell tip lift has just been like amazing. So patients love the idea of get a little tweak without major downtime. This generation is all about like fast, right? Instant results, fast. We want instant gratification. Also,
people going back to their office, they have jobs, they're busy, they can't go and lie in bed for 3 weeks for a procedure. They're not going to go to...
And they're a little scared of surgery. And they also, you guys have the power to change and tweak yourself to be the avatar you see yourself being in your head. Which is so cool.
So with you and your philosophy, what do you say that is in terms of beauty? Because I see a lot of different pages, and there's one specifically on Instagram, and their page as a medical professional or as in the beauty cosmetics world is like almost beauty without anyone putting, say, boundaries on that, for example. So if you want like an extreme look, almost like how on Botched, there's a lot of people that go on and say that they wanted a very specific type of contour with their body, or they wanted their nose to look like an alien's nose, and some people want that level of beauty. And I'm sure patients have come to you and they've shown very over-dramatic results. Do you give them that result if that's their definition of beauty, or do you feel it's better to go more the natural way? Do you turn those patients down? I'm just curious because so many people are now filtering their photos, and there's you guys watching, you know, see a lot of these influencers, and people are like, wow, like she has such amazing lips or nose and whatever, and they'll end up in your office, but it's something that might not even be achievable, or it might be extreme beauty. So that's why I'm kind of curious what your philosophy is on that.
Yeah, that's a great question, because yes, we see people who already have so much filler in their face, and yet they want more. And so I'm always a tiny bit torn, because I have a vision of what beautiful is. On the other hand, I don't want to impose my vision of beauty on someone else, right? So I will work with the patient to kind of accomplish some of their goals and maybe bring out those features that they like in the photo they're showing me without facial distortion, as long as it's safe, right? We don't want to do something that compromises patient safety or blood flow to the face or can give you a facial necrosis. So that's number one, is first keep people safe, and number two, if it's going to look garish or really, you know, hideous, I will discourage it, because people leave here with my stamp on their face, and if I'm the last person who touched you and people think that that's my work, I don't necessarily want that. On the other hand, I have girls who want really big lips, more than I'd want for myself, but what I think they can rock it, and like more power to them. I always say, like, I would never tell Dolly Parton, don't get big boobs. Like, that makes her Dolly, and
that's what she is.
She's Dolly, and she needs her boobs. Like, you can't regulate people. And I have so many haters on Instagram who, if I post a couple of my clients who love the big lips, they're like, go big or go home. Every hater has to open their mouth about it. And I always want to pick a fight with them, because it's none of your business to regulate that girl's definition of beauty. And like, let her live. That's my approach. Is let people live.
Well, see, I feel like a lot of people have misconceptions about fillers and stuff. A lot of people think that Botox is a filler, and people have all these like misconceptions of that. And I think people will come on different Instagrams and yours, other people, and they don't know because they're not a doctor, and they don't know like what to.
They also haven't taken 5 minutes to do any research. They just got to throw a comment.
But I'm kind of curious too, just for people who say, like, for example, they want bigger lips or something. They see someone like Kylie Jenner. I guess the best way to kind of say is like, even like my lips. If I came to you and said, I want Kylie Jenner lips, which I don't, but I'm just saying if I did, just to show if someone has like similar lips to me, how many syringes does that take? And what's like a general cost, so people know like what that would run them almost, because people don't have that expectation.
So people feel that one syringe does a lot more than it typically does. So one syringe, I think, can give you about 20 to 30% globally more volume. And if you think about it, syringe is about this big, and based on the lips, that's about a quarter, a quarter, a quarter, and a quarter. So overall, one syringe can look actually quite subtle, and on the other hand, it can look definitely improved. And I tell people to do one syringe per month till you reach your goal size, because we also have those people who say, oh, it didn't work. I did a syringe and it didn't do anything. Well, it did, but it gave you 20% more global fullness, and you do have to layer that in. Some people start with very little. So a Kylie look would be like 3 to 4 syringes once every month to keep it natural looking. And then at 6 months is where you do touch-ups. But, you know, until you reach your goal size, you do have to keep layering in the filler.
And that's 3,000 to 4,000 probably?
The filler is about 700-800 per syringe generally.
Right,
I think in LA, yeah, roughly about 700-800 per syringe. Low end, you know, maybe you find it in, you know, lower end places like around 400 or 500.
And it's all about the
person. If it's too low, it's too low. Don't believe those really low prices. You could get what you pay for. It could be fake or counterfeit products.
Well, that's what I wanted to ask you about and talk to you about as well, was about like fillers and stuff. The first thing I was just going to say back on what you were saying too, it's all about the skill of the injector too. You can have somebody do one syringe and make you look you know, abnormal, and you could have someone who's actually like an artist and someone who's like really great, able to know how to place it. So you're paying for the artist and the person who's behind the syringe as well. For what I was going to say too about like the discount Botox deals, because I was asking some of you guys too for like your questions for Dr. K and stuff like that, and a lot of people have all questions about like these Groupon deals. And one of my friends, she said that her doctor said that one syringe of Juvederm runs them say $750. That's why he charges $800 or more than that, however much it was. So then there was like misconceptions that her doctor was telling her no one should sell half syringes because then they mix it with saline, and there's all these different like kind of misconceptions on, oh, I see a half syringe deal, or even
there shouldn't really be a half syringe ever sold, and especially definitely there are rules and regulations, and we don't like to share a single-use injectable. That's illegal and shouldn't be done. So, and if someone was to do that, you should pay for the full syringe and throw the other half in the trash. That's the right way to do it. And that's typically not done. So when you find salons that are doing half-Cs, you have to wonder, like, okay, who got the other half of my syringe? Did they give it to me sterilely? Am I using something that's contaminated with someone else's bodily fluids, blood, etc.? That can be very dangerous.
What kind of price would you say is too low for like Botox when people are like $8 a unit, or like what is like completely like a scam?
Yeah, pretty darn low. So I would definitely say anything that's, you know, below 9, 8 is very low, and maybe you get that at some giant chain that has, you know, very low volume pricing, or someone who's not as skilled injecting you, or you're going to like a dry bar of beauty where you pop in and who knows. It's not like dry bar. It's not like a hair styling that you should trust someone to put a toxin in your face that can give you facial paralysis for 4 months. So I definitely want you guys to not think about the money, because in the big scheme of things, when you get a brow droop for 4 months, you're going to wish you had paid $100 extra, because it's definitely worth it to pay for a reputable person to place it correctly. And also to not worry that you're going to get an infection or get a used needle or something irregular. So I would say your lowest price for Botox should be like $9, $10 a unit is pretty routine. Like you know, it can be higher. But
now for someone who's specialty is fillers and the face, how do you feel like over the years it's changed in terms of fillers and the ideas of, you know, before it was all about one thing years ago, and now there's a lot more like frozen faces. People want completely no lines with Botox, and it kind of has shifted. And like, what started that shift, and how did it change, and how do you see fillers kind of now versus maybe 5-10 years ago? Because we see how people's faces are starting to change, especially in LA. You start seeing different things with lips and with faces. What have you noticed as the professional in that?
I think that is a great question, and a lot has changed. And I think in the beginning, with injectables, people were just really focused on lips and nasolabial folds. And now, I feel that I have also been responsible for helping create like a new way of thinking about fillers in terms of doing contouring and replacing volume loss as the facial fat pads change to create youthful appearances by contouring the face, like cheekbones, jaw lines, and almost like a non-surgical approach to facelifting actually. So I think a lot has changed. People now are pre-juvenation, like in 20 and 30-year-olds who use Botox preventatively. That's a whole new thing.
Right.
Whereas previously it's just people who mainly have lines and wrinkles were coming in to treat the problem. So the new approach is like prevent the problem. And I think that's great. I started Botox at 26, 27, and I just really have never got lines because of regular Botox. So pre-juvenation is a big trend, and the idea of not just going to get plumped up and filled up and just look like filler face. That's so important to see people who are going to inject you so that you have appropriate replacement of aging changes, and then you age gracefully and honestly and like age appropriately. And I'm not a big fan of the frozen face, but many people do like that look, that Instagram. Yeah, what I want us to avoid is running into this society of everybody having the same Instagram lips, same Instagram jawline, same Instagram look. Because, you know, like we've seen families where everybody looks the same.
Right.
Starting to look the same. See the same surgeon, we all look the same.
Right. In your society, and everyone has the same face, same appearance.
Yeah, and it's kind of ubiquitous now where everyone is getting Botox, so you feel like the weird person that you haven't tried Botox.
Right.
Like, right? At a cocktail party these days, it's almost hard to spot someone who hasn't had Botox.
But I think that's kind of like what the danger you're saying too is that all these people are now like seeing it on Instagram and on social media and on these influencers and YouTubers, and they want it, but then there's a lot more people trying to offer it who don't have any of the training. They think they can take a weekend course in Botox, and they don't understand the full facial aesthetics, like the study of that, I feel like, where people are going to like the Groupon deals and other things. I don't think they realize like the dangers sometimes of getting these are like serious medical processes. It's not like you said, the dry bar of Botox, and these places start popping up, and they don't realize like it's a serious medical procedure you're getting done. You're not just, you know, putting, you know,
it's not
cream
just
on
makeup
your face.
or so it's so true. And people don't have to take any classes. They can do a 2-hour training class. They could just be an RN, an injector, pick up a needle and start injecting. If they had any ethics, they could take a 2-hour class at least at the minimum. But after that 2-hour class, they can do anything they want on your face. And I think that complications from filler and Botox are highly underreported. So they just sort of get, you know, pushed under the rug, and nobody knows how many times people have problems. I see it because people come and they have bad filler dissolved. And you see it on the street, and the brain, the human eye just knows when it sees something's weird about that face. Yeah, and that is an example of like someone just innocently going to see an injector thinking like every injector is the same. If they know how to do it, they know how to do it.
Yeah.
So I went and I asked for my under eyes to get done, and look, I have these real huge puffy bags because the person didn't know what they were doing. So don't assume that every injector is the same. They're not. And do assume like that things can go wrong, because they can. And always protect yourself. Like, I'm someone who prepares for the worst. I'll always like research, think about everything, and then once that I've really done my homework, then I'll go for it.
Well, if someone wants to see an injector and they're not in LA, I mean, I recommend you guys fly here and see Dr. K if you can, but if someone's maybe in a different country, or they met someone, oh, I'm an injector, let me inject you, or something like that, what can they look for to specifically with, say, like Botox, especially if there's, you know, Botox coming in from different countries? Sometimes you hear about all these different stories and how they overdilute, and there's different things that could happen. What can someone look for with their injector to kind of guarantee like they're getting good product, and that the person that they're seeing is trained or qualified to maybe do these type of procedures? What would your recommendation be to those people?
Well, definitely look for experience, level of experience. And you can tell that based on how much Botox they go through. Many of us have a sign that says your gold, diamond, platinum level injector. The actual Botox box has a hologram on it, and there's 5 or 6 distinctive features that are even on the bottle. So if there's not a hologram on the label, it's very common that Botox can be imported from Canada, Mexico, India. None of that is legal in the United States. And, you know, maybe it's the same Botox we use here, but it's not legal to import it. And also, if it's missing all those things, then you can assume it's fake. So it's super scary because the fake files look extremely identical to the real ones. So I just really want to emphasize, like, the level of experience of the practice. Personal recommendations of a friend are really good. Level of certification means board certified in the core 4 specialties, which are plastic surgery, head and neck surgery, dermatology, and oculoplastics. Those are the core four. If you see someone in those four specialties, they have 30% of their training or more in aesthetics for the face. And like my specialty. Otherwise, you could see a doctor who's an emergency room doctor, a urologist, a dentist, yes, a GYN, baby delivering. You know, a pediatrician can put up a sign and say they do Botox and fillers. And my internists and people, it just surprises me that they want to even venture there.
Is it just like a cash grab for them?
It's a cash grab, but it's frankly, Botox is one of the hardest things to do. So those of you who think like, oh, they're just going to get some Groupon units, like, good luck to you, because you'll also get a little brow droop with that. And it only has to happen once for you to never, ever want that to happen again. But I hope it doesn't happen to any of you.
Can someone say request to see, like say they're getting their lips done and they're using Juvederm, could they actually request from the physician, like, can I actually see the packaging? Can I see the syringe? But people sometimes transferred from the syringe into like the insulin or the smaller. How would you know?
We do that. So ideally it would be transferred in front of you, or ideally you'd be in an office or a suite where you trusted them with the utmost and you don't even worry. But I mean, hopefully if you're letting someone touch and inject your face with substances, you have researched and trusted them to the utmost degree. Not everybody's the same. I'm sorry, girls and guys out there. Not everybody's trustworthy in America.
I have a question about Bellafill. Have you heard of Bellafill, the permanent filler? What's the drama about that? Is there drama? Is that safe to inject?
I love Bellafill. It's got large particles of a permanent substance. And anytime we put permanent filler in the face, it's kind of like putting permanent makeup. Looks good for a few years, and then everything about the face is going to change and morph with gravity, time, and aging. And more often than not, it can migrate, it can move, it can cause extrusion or lumps or problems. So I'm not a big fan of permanent products in the face.
Speaking of like beauty YouTubers and stuff, I was reading, because I was kind of Googling about YouTubers and their like plastic surgery and cosmetic treatments, and one of them that came up was a video that Jeffree Star did, and he was talking about how he had actual silicone injected into his lips. Yes. And what happened was he trusted the physician, was in Beverly Hills or something like that, and he thought he was, I believe he said it was getting Juvederm. I'm going to put it in here for you guys so you guys can see the article. So as you guys could see, he actually thought he was getting the actual Juvederm, and they injected silicone into his lips, and they actually had to surgically excise the silicone. And I've heard of other doctors too who have said, again, it's controversial, that sometimes they use like a medical grade silicone into the face, and I feel like, when would that ever constitute to be okay? Is it like if someone has facial wasting, or like when would you ever use that? Because now you hear a lot about breast implant illness from silicone, and how silicone is, you know, metabolizing and causes brain fog and all these different things. Is there ever like an instance where it's okay for someone to recommend to use silicone? I know it's not a typical thing, but on like what occasion is that ever okay?
I would say implant products, like for example chin implants that are encapsulated with medical grade, not necessarily silicone all the time, sometimes they're silastic or other plastics, but those are more likely to stay in one unit. Filler and injections of silicone that can disperse, migrate, and distribute, they really get embedded into the muscles of the lips, into the tissues in such a fashion that really, even when you open and try to take it out, it's quite difficult because it's integrated, scarred, and
have you had patients that you've ever had to do that with?
Yeah, with silicone for lips, it's quite common that people do that, like, oh, they went somewhere in their 20s and had this stuff injected, and now it's causing lumps and problems.
That's what happened to Lisa Rinna. So I was reading about her thing. Lisa Rinna wanted a more permanent result, and she got silicone injected into her lips. And it's kind of humorous in the sense that people gave her so much hell for so many years about having big lips, and now it's like the biggest thing to have
big
those
lips,
type of big lips. But for her, for a while, it's kind of like what I was thinking about with how like beauty kind of changes over the years. She was, you know, mocked for a while for her lips, and then now people are emulating that, but it's just scary to think that she had to get that surgical removal of that silicone. And I think she was saying that it had to inject cortisone or something to kind of soften it up, and there's like a whole like nightmare
it's
thing.
It's a whole process, so you just have to be so careful with what you put in your body. I definitely think it's a mistake to use the permanent filler that can give you health problems, and I just find it ironic that people are greedy. Like, you like big lips and so now you want them permanent because you just don't want to have to come in once a year or every 6 months. Like, you can't be like that. Your face, your body requires regular maintenance. There is not one procedure where you can just do this permanent instant fix. It's going to last you for so
Forever.
long. I wish, but the surrounding tissues change. Gravity, fat deflation, collagen changes are going to happen. So you're better off adopting a philosophy of regular maintenance, like for a car, versus like, I'm going to put in an engine that lives forever. It just doesn't exist.
Yeah, I just think it's going to last forever. Now, I've been seeing a lot on Instagram too, people are using like those Pdo threads. What are your opinions on that?
I hate those. I hate those. I hate
Are those because they say, oh, it builds collagen and it dissolves and it's going to lift. And I feel like the type of thread could maybe, you know, you're putting it in, it could be infected, or you're not getting the right type of thread. Or I've been trying to read about it.
I just think that people placing threads are extraordinarily sloppy. When I watch their Instagram videos, I cringe because there's no betadine, the thread's tracking across dirty hair right into their face, there's makeup still on. Just horrible technique-wise. And number two, the Pdo thread that's absorbable, that exists as a filler, injectable filler called Sculptra. Very predictable, it's easy to place. And why would I not just want the entire area to get nice volumization versus like a little linear thread of support? The threads don't actually anchor to anything. So if I'm going to loosely place a thread in a fabric, is it going to do much to tent the fabric up? Logically, no. As I sleep on it, as my muscles move, it's going to lose traction. So threads, there's a study done that reviewed 20 articles, 20 medical journal articles reviewing the efficacy and safety of threads, and 40% complication rate.
Wow.
Results that last 6 to 9 months only. Price was extraordinary, like almost $2 grand.
Yeah,
it's not cheap, and it doesn't last. So the real, you know, the rating on my assessment is it's not that great.
Because it may seem like, oh, because the way the threads are, it kind of goes into the tissue and hooks it up, and there's all these different things. And
problems with puckering, dimpling, extrusion. Definitely problems with like superficial placement where you can almost see a thread. You can read the real self ratings; they're horrible.
That's a good thing that you can go on Real Self too and look up the different providers and people who you want, even just for fillers, surgery.
Yeah, not even just providers, but also just like the procedure. Like, was it worth it? The was it worth it rating is not so much for threads. So use them with caution and with only like a really good injector.
I was just looking through because I have a lot of different questions people have been sending in to you that I want to ask. So I'm kind of picking out some of the good ones. Is there like a beauty myth that a lot of people believe? Like people say, sleep with avocado on your face. It's not that, but just like stuff like that. And it's just totally like, that's a lie.
Don't sleep on your face, that's
Don't
for
sleep
sure.
on your face.
Sleep on your back, definitely. Sleep lines are a real thing.
Is it real that if you sleep on one side of your face, you're going to get more indentation or volume loss on that side?
Yes, you'll get droopiness on the side you sleep on.
Is there like a pillow that they sell that
there's
could
a
keep
few,
you on your back?
yeah. The Sleep and Glow pillow's been pretty good. There's about 4 or 5 different pillows on the market that are really interesting that cradle your neck so that you're not sleeping on your face. So I highly recommend that. Don't ever sleep on your face. And the only proven skincare ingredient I would say that really helps with anti-aging is retinol. Retin-A actually. So Retin-A, tretinoin is the #1 best thing for wrinkles. If you're not on it over age 30, definitely get on it. If you want to try a really nice one, my Diamond Liner Fine is very gentle, not so irritating. So very important after age 30.
So a lot of people were asking questions about the skincare specifically. Someone said, what does she think about topical products? Like, do they actually have power to perform a lift, firm, anti-age aspect similar or close to injectables?
Yeah, nothing is like going to be like injectables. So, but Retin-A every night at bedtime, vitamin C every morning, and sunscreen, those are your desert island products. So if there's nothing else that you do for your skin, the things you do every day will keep you young and pretty and handsome. And it's the things you do twice a year to come and visit me that are good for long-term maintenance. But it's really the everyday skincare that's really important.
I was just thinking about like influencers and stuff too. Do you think that they're responsible for like over filtering and for the sense of making people feel that they might need a little tweak or two, or their lips or other things? Do you think that influencers need to be more responsible in what they show their audience in terms of, from a beauty aspect, of feeling like it's normal to maybe look this way? Or
yes, I do. You know what, I really respect the influencers who do show me themselves when they just woke up without makeup on a day when they're not wearing makeup and they're in sweats. And I love that, okay, they can glam it up and put the makeup on and show that really pretty image that we want to see too. But I really respect the fact that they show themselves as real people with acne, with messy hair, with bad days, with just like, this is how I wake up. And in a real way, because otherwise I think there's too much distortion, too much fakery out there.
now what happens if someone goes to see an injector and they get their lips done, for example, and something kind of goes wrong in that sense. What is the protocol? Like, should they go back to the same person who did those?
Yes, the protocol is always see your treating provider first.
Really?
Always have the courtesy to give them a call back and say, hey, this is happening, send a photo, go right back in. Don't be that person that writes like I'm going to write a bad Yelp review unless I get a refund. Like, that is evil and blackmail. And people do that, and it's not right.
But there's a course for them to, like, you can
you
dissolve.
You definitely can come back in,
fillers,
yes.
right?
And mostly we'll tell you to wait 2 weeks, but if you're not sure, if you have a badly bruised area, if anything's, you know, blanching, red color, you're just not sure, you've got to come in to get it checked, because filler can block arteries and cause major problems. But you can get filler dissolved if it's not to your satisfaction. You have a lump or a nodule. It is an art. It's not always just a science. There's an art to this, and sometimes we have to adjust the art to get it just right.
And is there like any celebrities now that you get more photos of now than maybe like 6 months ago or a year ago? Is that kind of shifting now that people want to look like a different girl, for example, or a specific feature? Like, what right now? I know my questions are all over the place, guys. They're just kind of coming to me, but is there any sort of specific, like, oh, everyone right now wants to look like Bella Hadid, where 6 months ago it was Kim Kardashian, before then it was whoever was then?
Yeah,
is that shifting?
I think definitely it's
recent?
shifting to where people actually are pointing to more of single features on people's faces versus I want the overall Bella Hadid look or the overall Kim K look. Instead, I get people who just like zoom and screenshot the lips or the jawline or the singular feature that they want on their face, which is interesting. But Bella Hadid is a popular one right now, so I think it does go in trends.
Because she got a lot of work done recently, I feel like. Her face has kind of changed recently
keeps
than what she
morphing.
used to look like.
Yeah, I mean, I'm sure she had a rhinoplasty, which she denies. I think she's had really amazing temple filler, which looks really pretty, and cat eye. And I think she just keeps doing little subtle things, and also she's just maturing. Like, she's no longer 14 anymore, you know. She's coming into her adult 20-year-old face.
If you guys haven't seen Dr. K on her Instagram and stuff like that too, I noticed that you've posted like things even in the past with like J-Lo and like other celebrities to try to point out and show women too, and this is from someone who is, it's your job to do fillers, injectables, but showing people like, hey, like it's not necessarily always the case where these celebrities look that way. Like they have one image on social media and then in real life they really have cellulite and different things, and I just think it's really cool that you do show people that, you know, it's not always what you see is what you get.
I did a post about J-Lo, and it's, you know why I posted it? Because I felt deceived. Because in my own head, I'm thinking all this time that J-Lo is like this miracle creature. Like, God, I wish I could age like that too. And she's had twins, I've had twins. Like, I feel like I'm seeing changes. Of course, you have to. If you don't acknowledge that change is going to happen and you're eventually going to be aging, then what kind of human existence is that? So, like, the fact that J-Lo's completely filtered in all those pictures where she's wearing that Versace green dress. The new images are so photoshopped. And when I saw a real image of her with the necklines and like a little bit of, you know, coarseness and skin wrinkles, I was like, what the hell? This woman who's such a boss girl, who I really think is amazing, for her to have that voice and that presence and not stand up there like, yes, I'm 50 and this is what I look like, and respect me and own this age. I'm just sort of saddened by that, because she has the power
and the platform to do that.
And the platform to do that. And the fact that she thinks that with her stature that she needs to Photoshop and take away every trace of age just saddens me, because she doesn't have to. We think she's killer and she's rocking it, and she should show, you know, this is what it is to exist as a woman on this planet for this many years, to have had 2 kids, to do this life. It's demanding, and I look fierce, and like, but I have some lines. Because it's very damaging to, like, even I was like, what? You're deceiving us? Anyway, if I had your platform, J-Lo, I'd be preaching a little bit more about like how women should look, how you should age honestly too.
Yeah, especially with a lot of beauty influencers and people, I think that they should, for their own audience and for their own self too, because then you're giving yourself, like, you feel like you have to live up to that at that point. Like, oh, I look like this way on social media, and I'm sure like seeing other influencers and stuff in person, like sometimes they don't really look like that in real life versus what they look like on social media, that it's almost like it then gives them, I would imagine, a complex where, oh, everyone's so used to seeing me filter, like I kind of have to look like that in real life. And
it's awful. This must be why they dash in and out of events and parties so nobody could like super scrutinize them, and it must be why they pay money to like pull all these images off the internet, because that they have the resources to do that.
Right.
And it's just kind of crazy because you can't live your life like that. And also as a mother of children, like I started to feel I was, you know, wanting to see myself very filtered all the time, and then I'm like, okay, this isn't right if I can't look at my own face in the camera without a filter.
Right, yeah.
Like you have to acknowledge that it's warping you a little bit.
In your mind. Now, my final question, I guess, to kind of like wrap it up is, we kind of talked about it as at-home treatments for people who maybe want a little bit more plumpness in their lips, or they want to have better skin. You have your skincare line, which we can tell them where to find it. What would you recommend if someone, say, wants a little bit more plumpness, whatever, but needs an at-home remedy?
Oh, well, you can try my lip plumper for sure. That feels like a syringe of filler, and it plumps you up from 1 to 3 hours, a little more pink color. It's really good for fine lines and crinkles, so definitely that's a great first step. And I hope that you guys don't use the weird devices that plump up the lips. Those are dangerous. Don't use the plasma pen, bad idea. Don't use that tattoo gun that, you know, puts filler all through your lips. That's
scary
horrible and gives nodules. Don't do crazy stuff. Like, I mean, the DIY is great if you're talking about like putting avocado on your face or putting some coconut oil on for like right before you do a shower or something. But in general, if you are not 20, you need to step up and use anti-aging products that are physician grade and that are actually going to work, because your skin will change a lot in the course of a month, even with really good ingredients. So I definitely recommend, like, step up your game, invest in yourself.
And kind of like what you've said before too, probably on social media where I heard you say this, it's like, you know, you're gonna see your dentist to get like a root canal, you're gonna go and you're gonna, you know, shave, you're gonna groom, you're gonna wax, or like do all these, you're gonna cut your nail, like you're gonna do different things for yourself, you're gonna see a regular doctor. So why would you not do anything for your face or for your own beauty, you know, if you're like even in your 40s, 50s, 60s, and you never have any sort of treatment routine, whatever, it's like you're setting yourself back from looking your best and feeling your best. And you don't necessarily need to splurge. You can just have 1 or 2 really nice medical grade products that you can just integrate and slowly start, when you can afford it or whatever it is, to start going and see Dr. K when you want to, you know, get some treatments done. So tell everyone where we can find you again, Dr. K, at Beauty by Dr. K on Instagram.
My Instagram is Beauty by Dr. K, DRKAY, and I do amazing things with people's faces there. And I will teach you every single day about all the tips and all the tricks. And
you're the best page. I love following your page.
How to stay beautiful.
And your stories.
And my website's the same. My podcast is on iTunes. It's called Beauty Bites with Dr. K, Secrets of a Plastic Surgeon. I'll teach you all my secrets.
I came on and did an episode, guys, just today. We just recorded my episode of Beauty Bites, which should be up about next week or so. Check out Dr. K's skincare line, guys, if you do want to start buying some of Dr. K's skincare. I'm going to link it down in the description box below. And if you guys want to see more videos from Dr. K and I, let us know if you guys have any video ideas or any suggestions. We'd love to maybe even do like some injection videos, or you guys say what you guys want to see. Maybe we can even bring on like an influencer and do a video and we can inject. Or we can let us know who you guys even want to see. Maybe we can bring some beauty influencers here and doing some videos. But you guys let us know. Thank you so much.
If you're interested to come in, send me a message on Instagram, and yeah, we're going to definitely show Steve's videos of his nose, chin, jawline.
Yeah, we took videos, guys, so that's going to be all on Dr. K's page. Again, guys, make sure you are hitting that red subscribe button, leave a comment down below, give this video a thumbs up, share it with a friend, follow Dr. K, links are down below. Thank you so much for watching, guys. I love you all, and I'll see you in my next video. Bye, guys.